snapping your ACL, probably a grade 2 MCL sprain on top, maybe even a buckle handle meniscal tear, maybe just a medial meniscal tear if he's lucky. The pinnacle, everything you've ever wanted to achieve, you've achieved. And then you just start losing your brain. Your mind does not serve you the same way it did before. Your body is not the same in the gym. Okay. So, you saw the title, you saw the thumbnail, you probably know what it is by now, right? We're gonna cover Conor McGregor's, very recent and very unfortunate injury. So I'll walk you through my list here of 4 pointers, right? The fourth part might need a whole video by itself because it might be a little complicated, but first 3 parts would be easy to go through in this video. So introduction is my first point. It was UFC 329, right? And if you follow mixed martial arts at all, you'll know that this was supposed to be a special night between Conor McGregor and Max Holloway, rematching after quite intense of a first match they had, and it was highly anticipated by MMA fans worldwide. Now, how did that end? If you haven't watched it, spoiler alert, it ended with Conor McGregor practically what they call blowing his knee out, and I'll explain what that really means later. Really in the first few seconds, unfortunately. And a lot of videos online too are kind of insinuating that Conor came into the fight hiding an injury, didn't want to disclose an injury, whatever it may be. And I'll definitely dissect all of that, including the sheer just impossibility of that being true, right? Not in any person's particular defense or for anybody's gain, really, just for the sake of truth. There is a lot of fiction on this topic online, so let's look back at what happened. Let's imagine the knee joint as such, okay? So obviously, your knee can bend like that, can even almost go like that, but you cannot bend it this way, right? Why can you not bend it this way? That is because of a ligament called the PCL, okay, the posterior cruciate ligament. And why the knee can even get balanced this way on the ground. Let's say the tip of this pen is your foot, and here's your knee, okay? Why can your leg even balance on the ground there when you're just taking off to run or trying to rotate and stay stable, etc.? That's primarily, let's say, the job of the ACL, right? And for Conor to have gone into that fight knowingly injured and throw a flying switch kick like that, whatever you call that, right? A Superman kick? I don't know. He could not have been conscious of his injury. Could he have been injured beforehand? Possibly, but the knee, right? The anatomy of the knee, it has a lot of complex connective tissue structures there, right? We're not gonna get into everything because the knee is a very complex joint, one of the most complex joints in all of nature, to be honest. We're just gonna cover 4 main ones here. And specifically, the 4 primary ligaments that make up the knee is, you've heard of the ACL, but there's also the PCL, the LCL, the MCL, and there's also the connective tissue that acts as a sort of padding, shock absorption with each step, really, called the meniscus, okay? If Conor had gone into that fight knowingly with a blown out ACL, his brain could not do that kick, right? Because best case scenario, you land on Max Holloway and you probably blow out your PCL too. And inside the knee, there's not just ligaments. There's a lot of very sensitive blood vessels that you really, really do not want to, let's say, insult structurally. One good example of that was NFL running back Nick Chubb. Not sure if he still plays, but he had a catastrophic, really, knee injury, and the primary concern was not even the actual ligaments, because obviously those were torn and they can be surgically, well, let's say, transplanted either through a graft, an autograft, or cadaver graft, whatever the case may be. We're not surgeons here, but to explain the anatomy for you, he could not have gone into that fight knowingly injured, because I mean, he might, of course, look, every fighter when they train for these kind of fights, of course they have some minor aches and pangs, little tweaks here and there. That's just all very, very normal. But he would never throw a flying switch kick like that if he had known his ACL was already blown out. Because if you go and read the official news, probably they'll just tell you, oh, it's an ACL tear. But it's rarely ever that, just in a vacuum, okay? The ACL, okay, let's say, so here is the medial side of the knee, and here is the lateral side, okay? This medial side of the knee, here lies a joint called the MCL, okay? And the MCL and the ACL really go together. Same with the meniscus. When Conor, let's say, flew like that and kicked and then landed on that foot, the MCL also tends to buckle with the ACL. And that ends up inevitably almost with a meniscal tear as well. So it's a complicated knee injury that he landed. It's not just an ACL tear. That's why this video can get quite complicated, but it's only for those who are curious. If you're just here for grifting, please click away. So that part I labeled fiction versus reality, okay? Third part is potential causes beyond the main cause. I would say dehydration from the day prior. I would say he jumped on hormones and jumped off hormones for this fight to be able to go back into the testing pool. If you don't know, Conor McGregor jumped out of the testing pool after he snapped his leg in half. But he has to jump back off of those steroids. And your bones may grow on those steroids, but not necessarily proportionally to your tendons if you haven't been on these steroids for long enough. And that includes, not just tendons, but also very tender and very crucial ligaments such as the ACL, the LCL, the MCL, even the meniscus, right? And that jumping off of steroids like that had to have been highly problematic for Conor. In my opinion, if I were to guess what kind of stack they gave him for him to recover from the snapped leg, it was the other leg, but it was a snapped leg versus Dustin Poirier, his tibia snapped and probably his fibula too. Just looking at that, remembering that injury. I would say the least they must have given him in terms of gear is 250 milligrams of testosterone a week, combined with 2 or 4 units of growth hormone a week. And having to suddenly come off of those, though not necessarily the growth hormone, but the testosterone for sure you have to come off, that in and of itself creates vulnerability in the connective tissue, particularly at, let's say, crucial positions that really bottleneck your entire movement, like the knees and the Achilles tendon, and so on and so forth. But another potential cause beyond the main cause being, the impulsive flying switch kick, is the actual impulse to throw that switch kick. So I did say in the beginning he would not have thrown that switch kick if he had known he was injured coming into the fight. Could he have gotten a grade 1 ACL pull the day of the fight due to the dehydration before? Yeah. Could he have gotten it the week of the fight? Of course. Also, could he have gotten it on his way walking into the cage, as some people are suspecting? Yeah, maybe. It's all possible, all of it. But the main idea is that he was definitely not injured coming into the fight, simply because his brain would not have let him throw a switch kick like that, unless he was really, really bad off in the context of chronic traumatic encephalopathy. But speaking of which, that impulse to throw the kick like that, that's pretty manic, right? In a situation as such. I believe Conor McGregor's, 37, 38 years old. You're not a feather anymore, right? And speaking of feather, he was fighting at 145, then got injured, ballooned up to 170 pounds. And by the way, these fighters, let's say weigh-in day, they don't weigh as much as they say, as much as the, let's say, pay-per-view card says they do. For example, Dustin Poirier and Charles Oliveira, when you've seen them fight at 155, Poirier retired, but anyway, we got another video coming about Mr. Dustin the Diamond Poirier and Charles Oliveira. They fight at 155, yeah, but they walk around, right, like in their off season, at 190, 200 pounds, probably, at least, right? A very, very healthy 155er would be someone like Max Holloway, right, who is about 180 pounds walking around, not on fight day. Now imagine that kind of a weight cut, losing, well, for Conor at 170 pounds, these fighters don't cut less than 20, 30 pounds. So a very, very generous estimate is 190, okay? And he must have had to really, really suffer through that, because he hadn't done it in a while and his joints are not used to that kind of torture anymore. Plus, additionally, that kind of a weight cut just being done suddenly out of the blue will make your joints, you're already, let's say, brittling joints over the years, because that brittleness does compound when you keep cutting weight. If you've seen Conor McGregor versus Jose Aldo Jr. on that fight, Conor was just unbelievably dehydrated. He was like a skeleton walking around. And that must have meant he had to cut 30, 40 pounds, something like that. And that does not come without long-term damage, not just to the brain, but also to the joints. Now, in the context of the brain, yeah, Conor has openly admitted having struggled with alcohol. He has allegations that he struggles also with cocaine addiction. And why would those affect him? Well, they both are very dehydratatory, as is. So even when he's not training for the fight, even when he's recovering, supposedly, and you see all these videos of him partying and whatnot, even if it's just a glass of whiskey a day, which I think it was more than that on average, to be honest, given the lovely, really Irish people I've met, they do love their whiskey, a lot of them. And yeah, that kind of dehydration over time, and that creates vitamin deficiency, it creates brittleness of the ligaments, tendons, joints, etc. You're just not the same man after that long of a layoff, recovering from a snapped leg on steroids, then coming off of them, then jumping, doing that jumping switch kick, and then landing on that foot, snapping your ACL, probably a grade 2 MCL sprain on top, maybe even a buckle handle meniscal tear, maybe just a medial meniscal tear if he's lucky. It's tough to say. It could be a peripheral tear too, which all of these are very tricky. All of these are very tricky for an athlete like Mr. Conor McGregor. And he's no dummy, right? Mr. McGregor has made his name in the sport of martial arts because he was dedicated, and because he was entertaining, and because he could call his shots and trash talk and all of that. And he's done very well outside of the cage too, in business and whatnot. But he hasn't taken much care of his brain, and that trickles down into just erratic behavior, a lot of impulsiveness, including that flying switch kick the first few seconds of the fight, not really calculating, just being very just snappy about things. And you could see that in his interviews, maybe not the ones coming up to this fight, but you could see that in all of his older interviews. And even now he was very just snappy, trash talking, and a lot of these fighters are when they get CTE. We'll probably do another video on CTE in the future, and what this early symptoms might look like, etc. But that's neither here nor there. As for potential recommendations for Mr. McGregor, right? Well, I'll lay only a few here, because in my ideal world, he would do anywhere from, well, just rough estimate, 30 to 40 different interventions between peptides, vitamins, minerals, maybe even a little bit of an herbal extract here or there, HRT. He would need a very comprehensive protocol. And I'm not talking about just for the knee injury, it's both for the knee injury and the CTE. But for the sake of time, and probably because he's not gonna watch this, and if he does, we'll be happy if he takes this advice. If not, unfortunately, his loss. So first, I would say alcohol and cocaine substitution, allegedly, right? CTE, yeah, it can make you impulsive, it can make you forgetful, it can make you even domestically abusive, honestly. But in the context of Conor specifically, I think it made him very depressed, right? And imagine having, reached the pinnacle, everything you've ever wanted to achieve, you've achieved. And then you just start losing your brain. Your mind does not serve you the same way it did before. Your body is not the same in the gym. Do you think you're just gonna be just happy, jolly, going on about life just because you have a lot of money in that case? Well, think again, really think again, because a lot of these guys, this is who they are. They've attached their identity to it. It's everything to them, their vitality, masculinity, fighting, all of that. So alcohol and cocaine substitution, allegedly, is very necessary here because, look, the depression is going to come back, Mr. Conor McGregor. And, you know, the moodiness, all of that, they will come back. I promise you that, okay? And I'll put my whole name behind this promise. They will come back. And instead of potentially drinking alcohol and doing cocaine just to feel, you know, happy again, normal again, just stimulated again in this life, I don't want to give anybody any strong ideas, okay? But in the case of Conor here, alcohol should be substituted with something else that's potentially GABAergic. I would say well, I will give a recommendation in the context of alcohol. The mildest option that Conor could take, mildest option that he could take to substitute both the alcohol and the cocaine, allegedly, would be baclofen, right? And baclofen would probably be dosed at starting 25 milligrams a day, maybe up to 100 a day, maybe up to 150 a day, whatever it takes for him to not have depressive symptoms and not have anxious symptoms all the time and feel like he can be calmer. And that would be just the first place to start. He may not necessarily react well to baclofen in the first place, but it is definitely the right box, right corner to start when it comes to point number one, which is substituting alcohol and cocaine, allegedly. Number two is hormone replacement therapy. And yeah, I would do the whole scope. I would do testosterone, maybe not 250, because I think they gave him a little too much last time. I would do maybe 150, right? I would do the 2 units to 4 units of GH every day. And I would definitely do 25 to 100 milligrams of micronized progesterone before bed. That is necessary for him to be able to properly recover in every aspect, talking about the physical side and on the side of his chronic brain disease, which is chronic traumatic encephalopathy. And, you know, CTE does not just stop in progression if you stop taking hits to the head. Once it starts, there's no evidence that we can stop it as humans. Well, there's a lot of suspicion, a lot of potential, a lot of curiosity, but it hasn't been identified in studies by any properly, let's say, decorated or trusted authors that, okay, this patient definitely had CTE and I diagnosed him at age, let's say 38, 39, and now he's 80, right? And I've prolonged his life and he hasn't shown any signs of CTE. I would love to work on a study as such, but that's far into the future. Number 3 would be a peptide protocol specifically for his knee and brain. Frankly, I would do 2 milligrams of each of these, Cardiogen, Pinolon, Vesugen, Vylon injected every day. I would add a nasal spray where he would dose himself intranasally with 300 to 500 micrograms of epitalin and cortigen, let's say around late afternoon, and potentially GHK copper at up to 5 milligrams a day, honestly, just to help him heal up properly. That would be my peptide protocol. And above and beyond that, I would, step 4, let's say step 4. So I'm assuming he does take a lot of vitamins, minerals, supplements, and all that, and he has his own coaches that he listens to in that regard. But I would definitely hammer the vitamin K here, particularly MK7 and MK4, both together. Not gonna get into doses because it does get tricky a little bit, but I would hammer both of those together for sure. And, well, one last recommendation I would say is both retirement and a beta blocker therapy for the rest of his life. Because if my suspicions and other people's suspicions based on that movie that he did, Roadhouse, I think it was it Roadhouse? Maybe. And so Roadhouse and that fight with Habib, those really showed signs of potential drug abuse and, well, allegedly, right? If there was cocaine as he was accused of, and for that long of a period, the beta blocker will not just help with his recovery, but it will, for his knee and his brain, it will also help with his heart not being arrhythmic long term. It will help him live longer, in my opinion. Might gain a little bit of weight, but who cares? I think he should retire. I don't think he will. I think there's probably like one more comeback left in the tank, but he should. He definitely should. It's getting self-destructive, and I hate to see legends just destroy themselves, as was the case with Tony Ferguson. It's always tough to see and never pleasant, but we are here to just help spread knowledge, information, and hopefully Mr. McGregor sees this and actually benefits from this video, because instead of all of the well, not all. Shout out to MMA On Point. They made a nice video on Conor McGregor. But I did see like some MDs, right? Like going on podcasts like, oh, he was 100% injured going before that fight. I know it. I have seen that pattern so many times. Like you actually did see people like that talking, oh, he was injured 100% before the fight. MDs and fans alike, and both combined too. This is none of that. This is just to provide some clarity on the topic for you guys as well as for Mr. Conor McGregor. So yeah, I hope this helps you guys understand the situation more. I definitely hope it helps Mr. Conor McGregor as well. And yeah, be sure to like, comment, subscribe. And yeah, if you want to see more videos like this, Peptide Science Institute is the place to be. My name is Dr. Ali, Head Transformation Specialist at the Peptide Science Institute. Thank you very much for watching, and I will see you next time. Goodbye.